The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the maze of healthcare policy and economics each week. My name is Marc Ryan, and thanks to everyone for listening in. The title of this week's podcast, Reform Models Hitting Potholes. We will take our usual 3 breaks, so let's get right into it. So let's start with part 1, setting the stage, the intro and the context. Let's start with something most people across healthcare actually agree on. The traditional Medicare fee-for-service system is outdated. It rewards volume over value. It incentivizes more services, not necessarily better outcomes. And for years now, policymakers on both sides of the aisle have been trying to fix that. At the center of this effort is the Centers for Medicare and Medicaid Services, CMS, and more specifically, its innovation arm, the Center for Medicare and Medicaid Innovation, or CMMI. Now, under the Trump administration, CMMI has been operating at a fever pitch, rolling out a wave of new reform models designed to accelerate value-based care. And I'll be honest, I've been one of the critics in terms of the number of reforms coming out of CMS in the past. Over the years, CMS has introduced a dizzying array of models. Providers struggled to keep up. Benchmarks varied. Populations overlapped. Outcome measurement overlapped. And the result? Confusion, fragmentation, and what many describe as pilot fatigue. In fact, healthcare became so acronym heavy that entire websites now exist just to decode it all. But here's where things get interesting. The current administration made a deliberate shift in philosophy. Instead of slow incremental pilots, they're pushing faster innovation cycles, greater use of technology, more aggressive movement toward value-based care. And frankly, I've softened my stance a bit, because if even 1 or 2 of these models truly succeed, if they bend the cost curve and improve outcomes, then maybe the experimentation is worth it. But there's a growing issue. The fatigue of the past is back. Health plans and providers are starting to feel overwhelmed, not just by the number of models, but by the speed at which they're being rolled out. Applications, deadlines, implementation, all compressed into incredibly tight timelines. And that's where the potholes begin to show up. With that, we will take our first break, and when we return, we will get into some of the potholes showing up. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan. We are talking about the drive for innovation in the Medicare fee-for-service program, CMS's aggressive reform agenda, and some potholes showing up in the road CMS has mapped. So let's get to part 2, the access model. Big promise, real friction. I told you I'd give you some examples of where this fatigue may be setting in. So our first one is the access model. It's been highly talked about. ACCESS stands for Advancing Chronic Care with Effective Scalable Solutions. Announced in December 2025, it generated a lot of excitement, and for good reason. At its core, ACCESS tries to do something pretty bold. Pair technology companies directly with Medicare fee-for-service providers, focus heavily on chronic disease management, push patients toward more engagement, nutrition, fitness, and remote monitoring. This is a real shift. We're talking about wearables, remote patient monitoring, data-driven interventions. In other words, bringing Silicon Valley-style innovation into traditional Medicare. On paper, it's compelling, but execution is another story. Here's what happened. Applications were due April 1. Contracts were awarded shortly thereafter. The launch date is July 5th. That is an extremely compressed timeline. And while about 150 organizations were approved, CMS actually had to extend the application deadline to May 15th. Why? Because participation wasn't as strong as CMS expected. And that makes sense when you think about it. Technology companies, they're not used to Medicare rules, compliance, or billing structures. Providers, most haven't heavily invested in remote monitoring or clinical care coordination at this point. And then there's the human factor. Building partnerships between tech firms and traditional providers is not easy. Different cultures, different incentives, different ways of working. Even the quality metrics, while simpler, are still unfamiliar. So what you get is this tension, a model with huge long-term potential, but real short-term friction in adoption. And that's a theme we're going to see again. The good news here is that CMS contemplates rolling additions of technology companies and participants in access over time. But how well things go early on is important for ultimate success. With that, we'll take our second break, and when we return, we will cover more reform models, perhaps facing challenges. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan. We are talking about the drive for innovation in the Medicare fee-for-service program, CMS's aggressive reform agenda, and some potholes showing up in the road CMS has mapped out. So let's get to part 3, the ACO LEAD program, Stability Meets Speed. ACO LEAD is the proposed successor to the current ACO REACH program, and it's designed to address some long-standing concerns in value-based care. First, what's new? A 10-year participation horizon for greater stability, elimination of rebasing, which has frustrated many providers, expansion to include Medicare, Medicaid populations. All of these are smart, thoughtful improvements. They address real complaints from providers who said, give us stability, give us predictability, let us invest long-term. And CMS is doing exactly that. But once again, we run into the same issue, timing. The model was announced in late March. Applications are due in mid-May. Implementation begins mid-September. Full launch would be January 1, 2027. That's a massive amount of change to absorb in just a few months. And early signals suggest providers are feeling anxious. Participation may be lower than hoped. Not because the model is flawed, but because organizations simply don't have the time to analyze financial risk, build infrastructure, align leadership. So we're seeing a pattern emerge again. The policy design is improving, but the rollout speed may be undermining adoption. With that, we will take our last break, and when we return, we will get into one last model that should be life-changing for many, but plans in this case are sitting on the sidelines. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan. We are talking about the drive for innovation in the Medicare fee-for-service program, CMS's aggressive reform agenda, and some potholes showing up in the roadmap CMS has outlined. So let's get to part 4, balance, GLP-1s, and the bigger picture. Let's talk about the balance model, one of the most fascinating and controversial efforts so far. Balance stands for Better Approaches to Lifestyle and Nutrition for Comprehensive Health, and its focus, expanding access to GLP-1 weight loss drugs, pairing them with lifestyle interventions. GLP-1 drugs are already part of Medicare and Medicaid, but really only for traditional disease states like diabetes and heart disease. Now, balance would theoretically expand to those with just obesity alone and no other underlying disease states. Now, I'll admit I've evolved on this issue as well. Initially, I supported limiting expansion due to the enormous short-term costs. But the landscape has changed. The administration has negotiated aggressively with major drug makers, introduced most favored nation pricing concepts, and pushed down drug costs in meaningful ways. And at the same time, the data on GLP-1s is becoming hard to ignore. Research shows nearly 8% of all prescriptions in March 2026 were GLP-1s. New prescriptions grew over 21% in just a few months. Millions of patients are now using them. And beyond weight loss, we're seeing potential impacts on diabetes, as I said, cardiovascular disease, and on long-term healthcare costs. So yes, there's real promise here. But here's the problem. Health plans are in a tough financial moment. They're dealing with rising utilization, membership shifts, rate pressures, and lingering policy impacts from prior changes in Part D. So when Balance came out, it asked plans to take on even more financial risk. And the result? Not enough participation. CMS has now delayed the Medicare portion of Balance, but is continuing it in Medicaid. But it has extended the bridge program through 2027 in Medicare Part D, and the government will pay the costs of drugs for the time being. This gives time to gather more data and reassess. Interestingly, United Healthcare, the largest Medicare Advantage provider, has signaled it may still participate in the future. And that's important because this model, more than most, represents a long-term bet. Short-term costs versus long-term savings. And with Americans living longer, GLP-1s may end up being part of the solution to reducing total cost of care. So where does this leave us? It's actually a pretty nuanced picture. On one hand, the administration deserves great credit for bold thinking. They're pushing technology, value-based care, and drug pricing reform. On the other hand, the pace may be too fast. The system itself is still antiquated, and financial pressures are real. In short, the vision is strong. The execution may need adjustment. Sometimes innovation isn't about going faster. It's about going just slow enough to bring everyone along. That's it for today's episode. Thanks for listening to the Healthcare Labyrinth Podcast. If you enjoyed today's episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I am Marc Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.